This podcast is for informational purposes only and is not intended to be used as personalized medical advice. It's a common, often very debilitating condition among adults, so we're discussing arthritis and how it's treated. Our guest, Laura Grantham. She's a physician assistant in rheumatology at Skagit Regional Health. This is Be Well with Skagit Regional Health. Thanks for listening. I'm Joey Waller. So first, in a nutshell, what does a rheumatologist do exactly?
A rheumatologist diagnoses and treats musculoskeletal disease and systemic autoimmune conditions. Rheumatologists treat joint disease similar to orthopedists, but do not perform surgeries. Common conditions treated in rheumatology are rheumatoid arthritis, gout, lupus, and psoriatic arthritis.
So we're focusing on arthritis, as mentioned, and there are a few different types. Can you tell us what they are and what's the difference between them?
It's important to know that arthritis is not a single disease. It is an informal way of referring to joint pain or joint disease. There are many different types. There is osteoarthritis, which is a more degenerative condition, and then there are a variety of inflammatory arthritises.
Let's try and narrow it down, for instance, to rheumatoid arthritis and osteoarthritis. What's the difference between those?
Osteoarthritis is localized inflammation, and it is the most common arthritis. It affects most adults over the age of 50, and it is the result of wear and tear over time. Rheumatoid arthritis is the most common inflammatory arthritis, and it is caused by the immune system.
And so what you're saying there is that one basically comes from age and usage over time, and the other one is being caused by other factors. So what about the symptoms? How do those differ between the two?
So, the symptoms of osteoarthritis is usually based on mechanical pain. The more you use the joint, typically the more pain that you will have. Whereas rheumatoid arthritis can also hurt with activity, but one of the hallmarks of this condition is prolonged morning stiffness. And then some people actually feel better the more they use the joint.
So how about treatment for both? What are the similarities or differences there?
Certainly. So the treatments for osteoarthritis are pretty broad. Weight loss can really improve pain associated with osteoarthritis. Exercise done the proper way can also improve pain in the long run. Support devices can be used to support joints, and heat and cold therapy can also be employed. There are some complementary medicine like chiropractic care and acupuncture, which can be helpful. And there's some other options medication wise too. There's some topical medications like capsaicin cream, lidocaine, and diclofenac gel, which can be used to relieve pain. Acetaminophen, which is Tylenol, can also be taken to help with sore joints. Some people also employ non-steroidal anti-inflammatory drugs, which are called NSAIDs. Some common over-the-counter examples would be ibuprofen and naproxen. Another drug that has been approved for pain and osteoarthritis is called Cymbalta or duloxetine. That would be requiring a prescription from your physician. We also perform joint injections for osteoarthritis. There are some newer modalities available for osteoarthritis as well, like platelet-rich plasma injection, stem cell use, anti-inflammatory diets, and CBD products. If all of these modalities fail, there also are surgical options. Some of them are arthroscopic, requiring small incisions, and then there's big surgeries like joint replacement. Rheumatoid arthritis, on the other hand, is treated completely with medications. We use medications that are called DMARDs, or disease-modifying anti-rheumatic drugs. These medications make changes in the immune system to help treat the disease. There is no cure for either of these arthritises, so it's important to know about their management, which a rheumatologist can help you to navigate.
So if someone thinks they may have arthritis, be it one type or the other, when should they see a doctor? How do they know the time is right?
You should discuss this with your primary care provider, and they can help you to know when you should seek out specialist care.
How about the way in which professionals like yourself go about diagnosing initially which type of arthritis the patient has in the first place? What's done there?
There is no one test to diagnose patients with arthritis. Typically, your rheumatologist is going to look at blood test results, examine joints and organs, and review x rays or ultrasound images.
In addition to treatment, you touched on this earlier, but let's maybe expand on it a bit, please. What are some of the ways a patient can manage their own arthritis? Because we're talking about weight control and some other things, right?
So, other things that you would consider, especially with osteoarthritis, is properly learning position and support of your neck and back while sitting or sleeping. You could also learn how to adjust furniture, such as raising a chair or toilet seat to become in a more ergonomic position. You want to avoid repeated motions of the joint, especially frequent bending. Losing weight if you're overweight or obese, which can reduce pain and slow progression of osteoarthritis. It's recommended that you exercise each day to help get the joint moving. You could also use adaptive devices that will help you do daily activities. You may want to work with a physical therapist or occupational therapist to learn the best exercises and to choose arthritis assisted devices.
Let's maybe just talk a little bit more about maintaining a healthy weight and exercising regularly. Explain, if you would please, why is it exactly that heavier people have more problems with arthritis?
Carrying more weight puts more stress on the joint with each repetitive motion. For example, walking. If you're carrying 10 pounds extra and you're walking daily, every time you take a step, that's an additional 10 pounds that your joint is having to support. So, over the period of one day, you could see how this would really add up.
Sure. In summary here, for those with arthritis, what would you say your message is about the chances of improving your quality of life?
With proper treatment, guidance, and support, patients can minimize pain and have a more productive and pain free life.
All right, well, folks, we trust you're now more familiar with the treatment of arthritis. Laura Grantham, thanks so much again.
Thank you. Have a great day.
And for more information, please visit skagitregionalhealth.org. Again, that's skagitregionalhealth.org. If you found this podcast helpful, please do share it on your social media. And thanks for listening to Be Well with Skagit Regional Health. Hoping your health is good health. I'm Joey Wall.